The multi-drug resistant TB hospital in Mudimule is currently treating about 100 patients. They have been diagnosed with MDR TB, pulmonary TB, and 4 are on the treatment for the more aggressive form of TB known as the extensively drug-resistant TB. Patients that are currently on treatment for MDR TB have been admitted to the facility for several months.
I was admitted here after testing positive and I received help and my vitals were slowly improving. I feel better. I'm grateful for the assistance. I was used to my TB medication according to the schedule, but then I stopped and defaulted. I returned to the hospital and I was extremely weak. I only started getting better when I came back to the hospital. I started taking the TB medication upon admission in the clinic. I first went to the clinic, then I was diagnosed with TB. That meant I had to be on treatment.
The Limpopo Department of Health reports that 80% of positively diagnosed patients are on TB treatment.
In terms of the treatment that they are taking, we have seen a serious success rate in terms of them being cured when they stick to their treatment. Even the numbers are showing that now at the end of the second quarter, we are 80% success rate for those who are taking their treatment. And also we are saying we have now expanded in terms of saying now when you present to any of our facility and maybe you came because you've got flu, but we see that the symptoms that are there might suggest that there's a possibility that you've got TB. So we are saying now we screen every person for TB.
South Africa still grapples with the scourge of tuberculosis locally that is also compounded with several comorbidities including HIV as well as non-communicable diseases like diabetes being in the forefront. That further adds a strain on the public healthcare system.
South Africa has an estimated 249,000 people who developed TB in 2024. 54,000 people died of TB in 2024. There are a number of high-level issues that are important. One is to catalyze health financing and investment, and ensuring that there's adequate domestic financing for health in general, but also specifically for TB. We're fortunate as a country as well that we have advanced diagnostics.
The recent G20 Health Ministers meeting in Polokwane discussed pandemic preparedness and response. The meeting also looked at ensuring that newer vaccines are developed to reduce the impact of tuberculosis as a public health threat. G20 ministers that met in Polokwane could not, however, sign a collective declaration regarding some of the deliberations that came out of the meeting. The declaration was not signed because the US rejected and disagreed with the health ministers' meeting theme of inclusivity in health, equality and global solidarity. Katlego Nyoni, SABC News, Polokwane.